your role will either be to portray a patient, portray an LVN or RN. If you are a patient, then you are going to go with Nick, and we're going to take you into the workroom, and she's going to explain to you everything about your patient experience, what it's going to be like for you. If you're LVN, you're playing two roles. You're playing night shift, giving report to the day shift RN, and then you're also playing LVN, and I'm sure you've noticed there's a lot of LPTs, LVNs on psychiatric units. So you are a nurse, but you're not an RN. The RN will be in charge. If you have the role of RN, you are in charge, and you're going to have to make some decisions about delegation so the job gets done. When we start the sim, at this point, we're going to aim for probably 12 minutes after 11. We'll try to keep it on our same time frame. But the sim is going to end, let's say, at 11:47. Sim ends. So you know that you have a certain job to do, which for the nurses, LVNs, we're going to explain what that is. But you know you've got that job to do until then. So in the meantime, I'm going to just go ahead and assign roles rather than have you pick up.
Observers, we are not your resource. If you guys, the ones playing the RN or the LVN, if you have questions, you use each other, because that's what you do in real nursing, is you ask another RN for advice or help or support. So remember, this is the nurses station in here. You can come in and, you can ask another RN for help with whatever question that you may have.
So, yes, so that's, but if you feel you need to call an MD, then you can approach either myself or, actually, we're more familiar with the scenario, so you could say, I'm going to need to call the doctor, and so we'll play the doctor on the other end. We'll just do pretend phone call, okay? Or you can approach the doctor on the unit and explain what you need, and then we could take it from there. But we've set up this scenario, so for the most part, you can make decisions based on what you know already. Okay, so we do have some parties, 2 of them. You've missed directions. So, okay. Alrighty, so we'll give them these 2 roles. And you follow Professor Dupree, and you're going to go into the workroom. If you'll notice, there's a little boys-girls sign on the door. So, what we're going to do is count off, and for 1, 2, and the ones, let's say, first of all, I think that's how we'll do it for the RN, LVN. So, LVN, RN, you're team 1, LVN, RN, you're team 2, LVN, RN, team 3, LVN, RN, RN, team 4, LVN, RN, team 5, RN, okay, LVN, RN, team, LVN, RN, perfect. Isn't it wonderful how we're so combined to do that? That's correct. Okay, so what I'm going to do is read to you. Can you shut the door, by the way, right now, because I don't want the patients to hear. Okay, so here's the situation. Your patient that you're going to hear about is a 68-year-old female, and she was admitted to a general psych unit. That's us. That's where we're at today. At 12 midnight, she was brought in by paramedics who phoned her after a neighbor had called 911. She had a small contusion on her left temporal area. She was admitted through, and by the way, I'm going to give you these things, because this is her chart, but you're good to take notes too. Not a bad idea. So she did have a contusion. She had a negative CT scan in her head. She was then transferred to the floor. Not too long after arriving in the ED, but she had kind of a rough night. This is what the neighbors told the paramedics, that she had not been seen recently outside of her house, and so they were coming over to her house about 6:30 to bring some food. Her dog had died 2 weeks ago, but her husband, who had Alzheimer's, had died 6 months ago. So they were kind of keeping an eye out on her. But they found was her on the floor, head bleeding, kind of extremely groggy. They called 911. They also noticed a lot of bottles around the house. So, place was filthy. It looked like she had fallen and struck her head on the sink when she fell on the bathroom floor. She had no food in the fridge. She had bottles of vodka. They were found around the bedroom and in the kitchen. While in the ED, she had said she only drinks 2 to 3 glasses of wine, but she started drinking vodka more because of back pain. She was angry in the ED about the embarrassment of being brought in, the hassle that the neighbor caused. She had 2 previous hospitalizations, one for depression, but that was 15 years ago. She's 68 now. And she had one brief detox from alcohol, but she feels like she was forced into it. No medicines were given in the ED, only a urine drug screen. That's all that was done in the ED. CAT scan, sent on her way. Okay, so she has a history of a gastric ulcer and hypertensions, and her home meds, which you'll have her record, but on her home meds, she's been taking Protonix, 40 milligrams a day, and Benazepril, 10 milligrams a day. She had an empty bottle of Norco. They found that in her home too. So here's the job. LVN, you'll have access to the chart. You're going to give report to the RN, so now you have a chance to actually start writing some things down. You're going to review today's labs. The lab sheets are on the lime green page. You're going to see if anything's out of whack. You're going to review the orders. So the RN's going to start strategizing. What do I do? You know, how do I get all this stuff done in the span of about 30 minutes? Because at 30-minute point, almost the 30-minute point, the simulation ends. So then you're going to, this is an alcohol withdrawal simulation, so you're going to have to apply the CWA and do a patient assessment. RN, you feel free to make some decisions on delegation. That's what this is about. So you make your assessment. You, if you're going to do blood pressure, you do a blood pressure, an actual manual blood pressure. We have 2 med rooms set up here. We have med station 1, that's for beds 1A, 1B, bed 2, bed 3, bed 4. So we follow this system. Bed 1A, 1B, oh, we have bed 2. I told Nick there's no bed 2. Okay, bed 2, 3, 4. The same goes for the med room over there. The med room are for the rooms, for the remainder of the rooms. If you'll notice, there's no bed 9, because that's our med room, and that's in the corner there. Just like, as you know, in a psych unit, there's not things around when you need them. So you're not going to find a place for hand hygiene. You're not going to place your gloves. You're not going to find trash cans where you can just throw anything. And also your sharps container, everything's in the med room. So, so you're going to have to problem solve and think through if you have to walk with medication or if you have to walk with an injectable med, you use a little container to put it in because you don't walk with a dirty needle. You know, so if you give an injection, you put it back here, take it to the sharps container and discard it into the sharps container. Should your patient need a urine specimen, you have the supplies here. Patient needs instructions, what to do with that, and the urine specimens are going to go here. So this is our pneumatic tube system, and that's our supply room for that. So I'm going to go ahead and give you guys the copy of these. When you get them, LVNs, again, this is your lounge, this is your space. Give report. Is everybody clear who you're with? So you're going to have to go find your patient. Let me review what patient you have again. There you go, Tyler. So, you guys need one? Yes, please. Oh, yes. We don't have one. It's all together. It's all together. Because one of you is the night nurse. Okay, so who else needs one? Okay, so you're going to, night LVN gives report, then you magically become the day LVN too. And then RN's going to make some Injections. Thank you, Courtney. Okay, so should you need to give an injection, what you're going to do is have the patient go in bed, you find the landmarks, then they come out of bed, you put the pad on the mannequin, and you give the injection. So you go nowhere near a human being with your syringe and needle, okay? But you're going to pretend like, okay, I'm going to need to find the landmarks, and then you ask them to get out. So they have to like shimmy the mannequin over a little bit in order for that to happen. Next thing. Remember, LVNs are nurses. So when you think about delegation, you're delegating to a nurse. So it doesn't mean there's a division of duties, like, oh, they can't do what a CNA would do. Yes, they can. Or they can't do what an RN can do. They can do everything up to assessment. So you can delegate with that. But you got to make some decisions. I think, tell me if you have questions before we get started. You need to know who your patient is, right? So I'm going to go through here. Go ahead, what is it?
I would say for LVN, so I just want to be clear with this. They can't do any assessments or meds. So anything else they can't do?
Have you noticed LVNs not doing meds?
So they can't do that?
They can do meds. They can do meds. But they cannot assess and reassess. Okay? That's the division. They cannot assess and reassess. You are bed 1A, 1B. Kyle, bed 2. Bed 3, bed 4, bed 5, bed 6, bed 7, bed 8. Where's bed 9? Okay, so we got our 10. We have no bed 10. Okay, so is everyone clear? Bed 1A, 1B, 2, 3, 4, 5, 6, 7, 8. Pretty soon your patients are coming in. Well, if you haven't started,
So are you gonna move on to the next task?
Yeah, to this one.
If you got it clear
Standing here. Yeah. Try not.
I think that's a really good.
How do we know this? Oh, that actually.
but you can tell them to go somewhere else too.
Okay, will you please come with us to the back?
Where are we going?
We're going down this corridor here.
Are you gonna give me my medication?
I just got here.
This is Ryan.
Well, I found at my neighborhood. On my head, yeah.
It's dying. It's dying. Here's one of the other batteries from the other one.
You know where you are right now? Okay, you know why you're here?
Okay.
Okay.
Because I've been sweating and, you know, I haven't had my medication.
You know what's do you feel dehydrated or anything? Yeah, it's not hot in here. Oh, it's just too bright. Oh, okay. Yeah, I mean, like, you guys turn off the lights. Yeah. Okay, we'll have those things.
I don't even know why.
So did you say you had any itching or needles? Like bugs are falling all over your skin? No? Okay, great. Awesome. Your eyes are hurting, your ears. Can you tell me if you're feeling sick or nauseous at all?
On a scale from 0 to 7.
Okay.
0 being yes. 7 being worse.
I don't really take anything now. I just feel anxious. Okay.
So vital signs, blood pressure is 140 over 90.
I am on a blood pressure medication, and my blood pressure, I am worried about that. So I could get my blood pressure.
Okay. Yeah, we'll definitely look at that also.
Okay.
And then what about, are you, besides, you know, lights being too bright, does it sound really noisy in here, or are you getting any agitation from some of the sound you hear?
No, not really. It's just the lights. Yeah, the lights are really bright.
Okay. All right. Well, do you have a? Do you think that? Okay. All right. Well, I know you've done a simple project. I don't see any visible sweating. Are you supposed to be sweating?
Yeah, I'm hot, and I just like I've just been perspiring nonstop. Like, it's hot in here, and the lights are so bright. Yeah, I'm sorry about that. Heart rate became feel moderate. Do you mind if we ask you a couple questions just to do a quick assessment? I'm not busy. I just want fantasy. That's all I did for my coffee, so
have you been having any itching or pins and needle sensations and burning numbness? Or like anything crawling on your skin?
I don't mind that. Just the lights are bright.
Okay. How about any abnormal sounds or any hearing any voices or
Any sensations, any burning or pain in your fingers or on your skin?
We are currently awaiting your last samples. I want to make sure that whatever sample we have is inspection grounds. So when you're going front to back, you're going to hold this cup out. Try not to touch inside it or in or around it at all. You're going to catch the air in the floor, let a little bit drip first, and then get the rest of it. And then screw it back on, and then you can bring it back to you. Okay?
Do you feel like your shirt is like getting wet from the sweat?
No, it's mostly the floor. I'm just like sweating so much.
Right. Okay. Do you feel anything crawling on your skin or even anything else that you lost a feeling anywhere?
So you said that your wife died about 7 years ago.
No.
How do you feel about that?
So now,
So you're stuck there. Like, whatever.
Other than, yeah.
How have you been dealing with that anger?
So, they all seem like get it.
My own business. Drink some wine. Get my mind off of it.
Okay, you have a patient. Okay.
Sorry. LVN here is going to, right? Tyler want to get a little cup and help you get your example on the medication. Okay. Yeah, so then you're gonna do that. I'm gonna talk to the doctor, and I'm also gonna come and go and I can't talk. I'm going to go and get your medication. We're gonna try to get to that as soon as we can.
Keep them linked in the packet. Okay. Yeah. Oh yes. Sorry, I didn't know that was a question. Yes.
Alright.
Yeah.
We are.
I'm pretty sure. Yeah.
Okay. Because I wasn't sure. It was like supposed to be 7. So you just gave it 4. So now. Very correct.
Is it okay? What I was gonna ask you is it 9 a.m. Are we giving 9 a.m. meds right now? That's what you're saying, right? That she needs right now? Okay.
Instead of 7, I would think that the thiamine would be needed stat though. So yeah, I would call the doctor if I were you and let them know that she's having. It's been pretty good. Some after C-section. Goes into thiamine. Yeah. Kind of schedule. I don't know if you can make that decision. No.
Are we on time?
I would think it would be fine.
I'm sorry.
Oh, you're fine.
Tell me how you want to divide that up.
Well, with our medications.
Whatever you want.
Okay, we don't have that. You don't have the drug screen results from the doctor. Or from the lab. From the labs. Did they not do one?
Yeah, that would be nice.
Brian, there's a vitamin.
What was the dosage again? Of the Phenergan?
125 milligrams.
25 milligrams.
I am every 6 hours.
One ml. I'm sorry. What was the number again? 25. So we gotta do half this.
Are you sure that's in milligrams?
It's 50 milligrams per ml.
Okay, perfect.
So 1 ml is 50, so you need a half.
Just see if there's any contraindications of those two together. The vitamin and the okay.
Did you know the assistant real quick? He's just getting some meds. Do you have a minute? Yeah. Actually, you know, if you want to stay with her for right now, then is she still pretty anxious? Yeah. Okay. I'm glad just to stay with.
So that's as I am.
Yeah, do you have,
Alright, Shelly. So,
yeah, I think.
your LVN, Stephanie, she's gonna give you your next medication.
Again, this is for nausea and vomiting. It'll help with some of those symptoms.
I'll be right back. I'm gonna go get some more gloves, okay?
So we already did this arm, so we'll do it on this arm this time. Here's your process. Go all the way down the middle. Okay. Now it'll flush apart.
How are you feeling? Is that Ativan helping out at all with your anxiety? Are you feeling a little bit less shaky?
Sorry.
Yeah.
Group time.
There's some meds.
Group time.
Alright, so, okay. So here we have your folic acid, your thiamine, and your multivitamin.
Have a drink with that?
Sure. There's some water.
Okay, so I got the patient with last night, assault, intoxication, 64-year-old nausea, sweating, anxiety, but she is not on her blood pressure medication. So
I didn't ask if they were doing right.
Okay, we're calling the sim now. The sim is done. Thank you. We just want to get the lay of the land, where everyone is at. Did your patient require any injectable meds? Yes. Okay. And they're in group right now. Did anyone feel kind of sheepish about pulling their patient out of group, taking their meds? So, you know, if you were the RN and you knock on the door, I need Mrs. Jones' bed to come out. So that would be fine to do that, to pull them out of group. So let's, while we're just standing here, we can talk about it. How does that feel?
So much easier in the hospital.
Okay.
Because you're on your feet.
I think this sim had a lot more involved, and so it was kind of complicated and disorganized in a way. Like I was like, what do I do? Where am I going? Like, I didn't know there was 2 med cards.
Okay, so even with the directions, it was hard to follow. But there were 2
because
cards.
it's a different setup from what we did on the last.
We're not
Okay.
Yeah, I was confused with, you know, you have the cultures up here. So my thought was
You might have missed that direction.
you went up there to get the cultures, but the lab values were actually on the sheet, right? The culture values are on the
Okay,
sheet.
what cultures needed to be done?
The urine.
Urine for CNS, so the lab values were where?
Are
On
they,
the med sheet? On the lab sheet, what did it say about the urine?
So it was in progress, right?
Pending, because it's not,
so I'm saying, but did we physically go up there, take it, and have her, like, you know, do a clean catch? That's what I'm saying. Like, do you go through all those motions?
Yeah.
Okay.